Hello, I'm quite excited to introduce today's guest, Dr. Malka Benshir. We're really excited to hear what you have to share with us. Please take it away, Dr. Benshir.
Okay, thank you. Okay, for those of you who don't know me well, I am a specialist in neurooptometric rehabilitation. I don't do general eye care at all. I literally reprogram brains after stroke and brain injury, and I work with patients with many complex neurological disorders. So I'm on staff at 5 rehabilitation hospitals in addition to my private office. When I see patients, those patients that can talk will almost always ask, how did you learn to do this? Because it's not a common specialty. Not many people have heard of this. And there just aren't that many of us, nobody in the local area other than myself. The simple truth of how I learned to do what I do is anything I need to know, Hashem makes sure I need to know it. Yes, I've taken courses. Yes, I've learned from the best people in the world. But it's a little more specific than that. I'll give you an example. Yesterday morning, I woke up early, which I tend to get up very early, and was checking my email, and up pops some information that I had never seen before about chronic migraine. Now, that's not directly related to my specialty at all. And it was information on some research about nutritional supplements that can help patients with chronic migraine. So I did what I had to do at home. I go to the hospital, I do my patient rounds, and I had an occupational therapy student shadowing me on my rounds. After we were done with all of the patients, I sat down with her to explain what the patient's problems were, what the tests meant because she'd never seen any of this before, and what I was going to do to help each one of these patients. In the course of explaining things, I notice her seeming a little bit uncomfortable, and she's looking at the tablet and looking away and having some difficulty making eye contact with me. So I asked what was wrong, and she said, "Oh, nothing. I have chronic migraine." I said, "You're the one! I was wondering who needed to know about this." She said, "What?" I said, "Let me tell you what we need to do." And was able to give her very specific recommendations about nutritional supplements that will reduce the frequency and severity of her headaches, and many other things that we're going to do to help her get off the unbelievable number of medications she takes in order to function. What's remarkable about this is that it's not remarkable. This happens to me all the time. Something unusual, and I know somebody needs this. I need to be able to help someone with this. And so I look for the person, and I'm always tremendously grateful that I have the opportunity to earn a living in a way that lets me truly help people in a way that I believe is a Kiddush Hashem.